So really just a very brief introduction. So the company really started, well, we launched the first platform in 2010, and at that point it was not much more than a basement operation where myself and the co-founder Jorge, who's going to be here later, we were going on trains out to patient organisations and presenting them with our idea of what could be a platform that could help patients, health users and patient organisations. In 2011 we launched pretty much the platform that you're all using today, and at that point we had 4 charities on board with us. We then, over 2011, we brought in 40 more charity partners to use the technology. In 2012, we got our deal with NHS Choices that we could be the sort of plug-in social media platform that any charity could use to work with NHS Choices. And we now have, I think, about 230 or 40 charities, mostly in the UK, but increasingly in other countries, using the platform. We'll tell you a bit about what we plan to do with the new platform in future, but it's definitely not just a UK thing, but international. It's really, in terms of today, this slide is really just more about what our priorities are addressing the needs of people who use health, i.e. everyone. We don't so much like to talk about patients because I think we're all patients, and it's about making that experience empowering and much more useful. My background is I'm a spinal surgeon by kind of training, and I worked sort of 6 years as a medical student and then 6 years as a surgeon, and I was very frustrated about the fact that really nothing had changed for the people that were coming to see me, in terms of having probably about 7 or 8 minutes to interact every 6 months at best. That really hasn't changed much since my grandfather or my great-grandfather, who were also surgeons, were practicing. And in a world where every other industry was changing, it seemed crazy that wasn't sort of an option to improve both my interaction but patients' abilities to get better value out of healthcare and health decisions. So today is a bit about how can we make this, which we've surveyed a lot of people who use the platform, and I think we have had an impact, but we want to make that much stronger, and actually the impact of the real decisions that you have to make as patients every day, not just when you're visiting healthcare services, better. And the other thing is really, particularly while you're here, is we want to make the platform, we want to be a platform that is a no-brainer for any organisation, because it simply delivers obvious value to the organisation, both in the way it hopefully addresses some of the technology needs for your membership, but also in all of these other things that we're trying to do. So we're trying to bring new audiences into organisations, we want to bring new resources into organisations, and particularly we want to focus on the volunteering and the lack of need to be a technology expert. So this is a system that we want everyone to be able to use. And so today this is sort of where you come in, and we want to hear a lot from you about your needs. We can get so much from our users, but it's actually the key stakeholders, which is you and our platform, that we really also very much care about. I think that's pretty much it for me.